Zamfara state government announces release of Jangebe schoolgirls 4 days after mass abduction. NCDC records 360 new cases of coronavirus infections in the country. In international news, Brexit having an expected brain drain effect on Britain as many professionals now migrate to other EU countries. And in sports, Minister of Sports Sunday Dare says National Principals Cup is back to stay.
This is ANN News.
I am Olajumoke Olatunji. Kidnapped students of Government Girls Secondary School Jangebe have regained their freedom. Zamfara State Governor Bello Matawale made this announcement early this morning that the girls have returned safely. He also said no ransom was paid for their release. The girls were abducted on Friday by bandits who stormed their school on motorcycles and pickup vehicles. Nigeria Center for Disease Control has announced 360 new cases of COVID-19 on Monday, bringing the total number of infections in the country to 156,017. The new cases were reported in 18 states and the Federal Capital Territory. The health agency also recorded 8 fatalities as a result of complications from the virus. This means 1,915 persons have died so far since the virus was first detected in the country a year ago. 120 of the new cases were reported in Lagos, 38 in Edo, 25 in Kaduna, 23 cases each in Imo State and the Federal Capital Territory. 15 other states also recorded cases in double and single digits respectively. NCDC says 136 persons are fully recovered and were discharged on Monday. For a year now, the COVID-19 pandemic has wreaked unprecedented havoc on families and communities around the world, disrupting vital services and putting millions of lives at risk. As correspondent Kelechi Mekalan reports, school closures during the pandemic have resulted in more underage pregnancy among Nigerian girls.
I feel so bad. And then I'm so hungry.
The frustrations of a pregnant 15-year-old whose real identity is concealed as she narrates her ordeal.
One of my uncle's friends used to come to our house. Sometimes he used to watch film, he used to touch me, he was me, he used to sleep with me.
Fati's life has been on a downward spiral. Dealing with the physical and emotional trauma is hard enough. She's also had to drop out of school. Millions of girls like Fati have found themselves in similar situations. Their hope of returning to school has been dashed.
They drop out because there's all this manner of stigma. You know, they're made to feel as if they've committed the worst possible offense socially. You know, they're made to feel as if they've broken taboo. And that's one of the reasons why many of these girls hide the pregnancy. Some will not say they're pregnant until they're so advanced, you know, in the pregnancy, and that puts them at risk, maternal risk.
According to a World Bank report, about 11 million girls from middle and low-income countries like Nigeria may never return to school. This is as they become vulnerable to sexual and domestic abuse, forced labor, and underage pregnancy amid the COVID-19 pandemic. For a country like Nigeria, having more girls out of school has far-reaching consequences.
We lose $200 billion every year by not adequately educating and utilizing the female members of our workforce. So that's money lost for the economy. Why do I say that? Is because, you know, most of these women drop out of school, you know, so they're not able to become financially independent in many cases.
Education for the girl child in Nigeria has been at the center of conversations. According to the UN's children agency, UNICEF, 60% of the country's 13.2 million out-of-school children are girls. Factors like religious beliefs, insecurity, poverty, and gender inequality are major drivers of this statistic. It's now exacerbated by the pandemic, destroying the decades of efforts to reverse the trend. Experts say governments may need to enact policies that can support pregnant teens and reintegrate them into the educational system.
Leather products have been touted as Nigeria's second foreign exchange earner and are found in just about every home in the country. Even with economic importance, the leather industry still faces enormous challenges. Correspondent Tessim Akinde lays out what needs to be done to rescue the sector.
These African designs are just a few among Shoaibu Abdullahi's many works. He's been producing leather works like wallets, bags and face caps for more than 40 years, and he says the business is lucrative.
The leather business has been very profitable to me, my family, and members of my community. We're all successful producers using leather.
He also says he has trained over 6,000 people in leather work in his community. This community has become a household name in Jos because of their expertise in leather making. They say it's the best way for young people in the village to become self-reliant. Nigeria's National Bureau of Statistics says the nation's leather industry is worth over $500 million. It's an industry that could continue to grow if demand keeps up. However, producers like Abdullahi say they lack modern equipment to increase their productivity, which is why they want the government to step in.
We can deliver much better leather works with support from the government to acquire better machines.
Experts say Nigeria needs to diversify its economy away from oil, and offering more support to the leather industry is one way to do that.
They need to be encouraged, they need to be packaged, and government needs to help them with marketing. Once there's significant input in terms of export, it's going to diversify automatically, and it's going to enrich the people at macro level.
The Central Bank of Nigeria has committed to providing loan facilities to leather producers in the country. Until then, people like Shoaibu Abdullahi can only continue to hope to cash in on the opportunities that lie ahead.
Coming up, African stories. Africa faces challenges monitoring different COVID-19 variants popping up from different parts of the world. And later, international news. Brexit having an expected brain drain effect on Britain as many professionals now migrate to another EU countries.
You are watching ANN.
Welcome back. This is ANN News. The African Continental Free Trade Agreement has recently come into effect, and already Egypt is reporting some good news about it. The country says the rollout of the agreement is expected to double its exports to Africa in 4 years. Correspondent Adu El Maruki reports. We'll get back to that story, with so many coronavirus variants making the rounds around the world. Africa is facing challenges on how to monitor the different strains. Correspondent Julie Shura reports.
South Africa is one of few African countries able to track the coronavirus since reporting its first case last March. Routine genome sequencing also led to the discovery of a more transmissible strain, which drove the country's second wave.
It's quite expensive. It takes about a day or so to do the sequencing and then the analysis. But so you cannot do absolutely everyone, but we do a representative sample. From that, we learn which viruses are more common in specific settings.
Monitoring COVID-19 in other African countries hasn't been easy. Similar strains to those found in the UK and South Africa have been circulating on the continent, but it's difficult to tell which is driving a recent spike in cases and deaths.
So in South Africa, because we've got very good genetic surveillance, we are able to know that more than 90% of our isolates are the new variant. But at the moment, we do not know that, for example, for Mozambique or Botswana or the DRC or other places, because there's not enough surveillance being done there.
There's been some improvement since the pandemic hit. Efforts by the World Health Organization and Africa Centers for Disease Control have been ramped to boost testing capabilities.
Africa is busy setting up much better genetic surveillance systems to be able to pick up these variants more easily. So there's a huge effort going on through the Africa CDC at the moment to set up such systems, but there's still very limited surveillance in Africa.
So we really have to focus our efforts here and build all the capacity that we need to track the spread and the evolution of these new variants as they emerge. Clearly, what we need is the rapid rollout of vaccines in concert with all the other measures to contain the transmission. And what's very worrying is how far behind Africa is with getting access to the vaccines.
Africa has so far secured a tiny percentage of vaccines. Just a handful of countries, including South Africa, have started small-scale rollouts, but that picture may soon change. Ghana has received the first batch of shots from COVAX, an initiative run by the World Health Organization to help the continent acquire vaccines.
South Sudan is experiencing an uptick in the number of refugees returning home. The country does not end there, as it costs millions of dollars to resettle and assist them. Now, the United Nations High Commissioner for Refugees is calling for more funding to meet the challenge. Correspondent Patrick Hoyett reports.
The UNHCR says the returnees mainly come from South Sudan's neighboring countries such as Sudan, Uganda, Ethiopia and Kenya. Many are coming back to find their houses destroyed by the 6 years of civil war. The UNHCR says it needs more funds to build livelihoods for the returnees. The UN Refugee Agency says it also faces a challenge of how to ensure the spread of the coronavirus is controlled among the refugees and the returnees. China is donating $2 million to UNHCR in South Sudan, Tanzania and Kenya to respond to the threat posed by the virus.
Through China's assistance, we at UNHCR have been able to ensure that refugees and others have been provided with face masks, that we have isolation units in the hospitals, and that we are also able to sensitize the populations on sanitary measures.
Flooding and locusts in parts of the country destroyed crops that some of the returnees planted. The UN now says 8.3 million South Sudanese people are food insecure. The UNHCR says there are 2.2 million South Sudanese refugees in East African countries. The UN is urging South Sudan's government to bring lasting peace to the country to allow more refugees to come back home.
When we return, international news. Brexit having an expected brain-drain effect on Britain as many professionals now migrate to other EU countries. And later, sport. Minister of Sport Sunday Dare says National Principals Cup is back to stay.
You are watching ANN.
Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments. and all the hard facts you need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, Africa News Network. We do news right in a truly African spirit.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News. Researchers are working long hours at Cuba's best shot at solving its coronavirus crisis. They're working on Soberana 2, the island's domestically produced COVID-19 vaccine. Correspondent Luis Churillo has the story.
Cuba is about to commence mass production of its COVID-19 vaccine called Soberana 02 after a final phase of testing that begins next month, its final hurdle before government approval. Cuba expects to produce enough to immunize its entire population of around 11 million people, with plenty to spare.
As to Soberana 02, we have assessed existing production capacities, and this assessment reveals that we will have an estimated capacity to produce 100 million doses of this vaccine in 2021.
Soberana 02, along with 3 other COVID vaccines in development, are products of a homegrown biotech industry that has exported vaccines against diseases like meningitis and hepatitis B to more than 40 countries.
For Cubans, the locally developed vaccine projects translate into the hope to finally get rid of the coronavirus disease, as they feel proud of the island's scientific community.
It's been a very big effort by our scientists. Very few countries have made such an achievement like Cuba has, and when vaccination starts, we will see the positive results of all of this.
We must praise our scientists who are making a big effort for us to prevent Cubans from dying and to help us kill this epidemic that is hitting us so hard. So I hope sooner rather than later we will all be immunized and happy.
The priority is vaccinating Cubans, but scientists here say Cuba also may donate vaccine to poor countries as part of its long-standing practice of healthcare diplomacy. Profits is not the point.
We are not a multinational where return on investment is the #1 priority and providing health comes second. We operate the other way round. We first create health and revenues are a consequence of that, never a priority.
Next month's Phase 3 trials will involve more than 42,000 people. If successful, Cuba says it could deliver its first 1 million doses of its COVID-19 vaccine in late April.
An expected fallout of the Brexit deal is now being realized in the United Kingdom, where many professionals are now migrating to European Union countries. This could create a serious knock in the country's security, economics and politics sector. Respondent Natni Kwani reports.
Daniel Kuhn moved to Glasgow, Scotland in 2013. The German professor in geology was lured there by the Scottish Highlands. He and his wife enrolled their 2 sons in school and bought a house. Then a few years later, in 2016, the Brexit referendum was held.
I remember getting up at 3 or 4 in the morning trying to check, and then it was clear that they voted to go out, and we were completely shocked. I mean, for us this was like really, really bad.
Kuhn says anti-European sentiment began to build. Added to that was the prospect of an uncertain future in the UK. They felt it was time to leave.
It was like a nightmare that became worse and worse and worse and worse, because it turned out to go more and more and more towards this really extreme Brexit idea, and also politics became more and more extreme.
Kuhn eventually found a job at the Friedrich Alexander University in Germany's southern state of Bavaria, and the family moved back in 2019, just before COVID hit. There are no official statistics on how many German scientists and academics have made their way back to Germany, but it has been noticeable, particularly here in the southern state of Bavaria, which has been benefiting from Brexit, not only with returning Germans, but also international academics and students. To entice top international scientists, Germany has launched a number of initiatives such as Bavaria's high-tech agenda, which comprises of a €2 billion investment to create 1,000 new professorships, 10,000 new university study places, and more than 20 new top research centers. Despite his family's mixed feelings about returning, Kuhn says they believe they made the right decision. Over the years, UK headlines have highlighted the brain drain or hemorrhaging of academic talent back to the EU, and it's Germany, which is their #1 destination.
At the moment, it's not looking good at all. It was a good mix to have the UK in there, so it's a bit sad that they're out.
South Korea has kick-started its vaccination program. The first groups to receive the jobs are healthcare workers, staffers at assisted care facilities and other high-risk people. The country's goal is to vaccinate at least 36 million, about 70% of its population by September. Correspondent Jack Barton reports.
A countdown to ensure vaccinations began simultaneously across long-term healthcare facilities in South Korea, where medical staff and patients are receiving doses of AstraZeneca, the first vaccine to be rolled out here.
This will make things safer here. As part of a medical team, I'm happy that this is happening.
The initial plan was to provide AstraZeneca to all patients here. Those over 65 will now have to wait for the completion of Phase 3 trials ending in March. Because of the delay, there were some reservations among younger patients.
It's better to be aggressive in vaccine procurement while cautious in vaccine administration. The government was too slow in procuring and administrating vaccines, which points to failure.
The aim of the first round is to vaccinate 289,000 healthcare workers and patients by late March. The government aims to vaccinate 70% of the population by November, with the aim of achieving herd immunity. The Korean Medical Association warns 90% would be a safer target, and even 70% is unlikely to be met by November.
I saw a lot of news before I got the vaccine. To be honest, I felt a lot of pressure before I got the shot. Now I haven't got any side effects, and I'm relieved.
A recent survey identified what may be another hurdle. Only 5% of South Koreans say they won't be taking the vaccine at any point, but another 45.7% say they won't take it this year, and they want to wait to see if there are any potential side effects. South Korea has been praised internationally for its COVID-19 response, but daily infections remain in the hundreds. The country's precarious situation has been described by the Prime Minister as walking on ice.
Up next, sport. Minister of Sport Sunday Darius says National Principals Cup is back to stay. Please stay with us.
You are watching ANN.
Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minutes in the world of sports. We give you information to stay on top of your investments and all the hard facts you need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, Africa News Network. We do news right. in a truly African spirit.
Welcome back. This is ANN News. In sport, Minister of Sports Sunday Dare has announced the revival of the National Principals Cup to help boost the development of football in Nigeria. National Principals Cup is a developmental grassroots event for the country's secondary schools. Dare made the announcement at the kickoff ceremony of the Principals Cup at Agege Stadium in Lagos. Ruth Usoro and Favor Olife are the latest Nigerian athletes to qualify for the 2020 Tokyo Olympic Games after meeting the standard set by World Athletics. Usoro set a championship record and tied the #2 indoor mark in the world with a leap of 6.82 meters to win the long jump at the Southeastern Conference Championships in the United States. Favor Ophelia also ran a personal best in the 200 meters with 22.75 seconds, making it the third fastest in school history. Earlier, Ophelia had the fourth fastest times in the 200 prelims, earning the spot in the final with a personal record of 23.15. That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook. That's ANN Africa TV. I am Olajumoke Olatunji. Have a great evening.